I'm Michael. I'm 16 years old. When I was younger, around 7 or 8, I would have to tap something a certain number of times or retrace my path. If I swiped a wall, I would have to swipe back in the opposite direction, cancel it out or even it out. It was never completely determined that I had OCD. Basically, they would just say he has anxiety, depression, nothing like out of the ordinary.
I remember Michael as a child. One Halloween we went trick-or-treating. As we're walking down the sidewalk, he would avoid the cracks and step over the lines and the cracks. And right away I went to, oh, did somebody teach you that? That's something I used to do when I was a kid. And sing the song, if you step on the crack, you break your mother's back. And I don't know if he thought that maybe my back would break if he stepped on the line. But at the time, again, I didn't think that was a symptom or a sign of OCD. I just thought it was a childhood game he was playing.
I was seeing doctors, but my OCD wasn't getting better. It was, in fact, getting worse.
He had said to me that at school he needs to move his finger, swipe it across the desk, and he has to reverse in the exact same spot. And if he doesn't, he becomes very anxious. I called the doctor. He said, well, he needs time to get used to the medication. A couple days later, more signs were coming. He wasn't able to sleep at all. He was pacing back and forth. He was definitely able to tell me that things weren't right, and he was nervous and scared. And it was just a time when you knew things were off. I mean, really off, and he was in a bad spot. He was always afraid 24 hours a day.
My OCD was one of its highest points, I'd have to say. Contamination snuck its way in there. I'd kind of avoid things such as doorknobs. I'd try and use my shirt to create a barrier between my hand and the actual doorknob itself.
You know, when your child is in distress and something's wrong, you're not going to be okay until it's like it was a problem I couldn't figure out how to solve. And it was so frustrating because there was no easy answers. And I knew I didn't know the answers. I knew I had to find somebody that did know the answers.
I've been participating in a research clinic here at Columbia Medical Center. I had never heard of exposure therapy until I got to Columbia. But once I got here and began exposure therapy, I got better. I would deal with my fear of germs in exposure therapy. I'd put my hand under the table and just try and get any germs off of it as much as I could.
We take it very seriously about wanting children and families to leave us better and feeling that they've gotten some benefit after they have completed working with us. And I think there's a lot that families learn by having this more intensive approach to their treatment. They learn more about what their child is struggling with. They have a better understanding about what is going on for their child, what is going on within the family around the difficulty that they're having, and that they have an entire team of professionals helping them and helping their child get better.
My first day here on the intake evaluation, I met a team, and everybody was knowledgeable and experience, and I knew within a few minutes after meeting everybody that I had found a place where I was going to get my answers.
When I first came here, I was a little nervous, not really quite sure what to expect. But once I got here, I could see everyone really did care for me and did want to see me progress. It wasn't just like, we just want your money or something like that. And they'd always check up on you each week during the study. Not just for research, but they actually wanted to know how you're feeling. You could pretty much, if you really needed to, just back out at any time.
Michael's doing much better, and it was because we came here, and the treatment that we received, and the education that we received by participating. We have the tools now to leave and handle the situation ourselves.
After participating in this study, I developed skills, resistance against the OCD. I no longer had to retrace my path on the wall or go over some cracks or worry about germs on the doorknobs. And, I just felt more free afterwards.